Hi guys, good morning. Yesterday when I was going through an article in an oral health magazine, I happened to see something about Arestin. I felt that it will be a good topic to talk about today, about how it is used, the fun facts, the pros and cons, how its future will be, right?
Yeah, that would be
Yeah,
great.
I have heard of Arestin, but there is my question for today's discussion. Does using Arestin really made a difference in treating periodontal disease, or it is scaling and role planning enough of its own?
Wow, excellent question. Let's break down things about Arestin and see how we can answer Olga's question, right?
Okay.
So
Yeah.
now, what is Arestin? Arestin is a locally delivered minocycline microsphere antibiotic. It's placed directly into the periodontal pockets after scaling and root planing. The microspheres slowly release the drug over and about 14 days, targeting bacteria that cause periodontitis. Now, let's see a fun fact on Arestin. Arestin comes in a tiny cartridge with a syringe like applicator. So small you would never guess it packed such a big punch.
Mm-hmm. That's a good information. So these are the
Yeah.
Arestin microspheres, right?
Yes. And advances, I'm going to discuss some advances in periodontology with Arestin. Periodontology has advanced dramatically. Arestin represents a shift towards site-specific therapy rather than systematic antibiotics. This reduces systemic side effects while delivering high concentration of drug right where we need it. That is the periodontal pocket.
Yeah, and also clinical trials have shown that when Arestin is used along with scaling and root planning, patients achieve a more greater pocket depth reduction and improved clinical attachment level compared to scaling and root planning alone. Now let's see a video on how it is administered.
Right.
For appropriate periodontal patients, administering Arestin at the time of scaling and root planing, or SRP, provides comprehensive treatment for greater pocket depth reduction than SRP alone. Arestin comes in ready-to-use single-dose cartridges that do not require pre-measuring or pre-mixing and are administered with a stainless steel dispensing mechanism specifically designed for this purpose. A new cartridge is used for each periodontal pocket, so the number of cartridges needed depends on the size, shape, and number of pockets to be treated. Arestin immediately bioadheres and gradually bioresorbs over time, so removal is unnecessary. Using Arestin is a simple three-step process. Assemble the unit by inserting an Arestin cartridge into the handle, then twisting until you hear it click into place. Remove the cap. Position the cartridge tip without force into the base of the periodontal pocket, keeping the tip parallel to the tooth's long axis. Press the thumb ring as you pull the tip slowly away from the base of the pocket to evenly dispense all of the Arestin. To discard the spent cartridge, retract the thumb ring and remove it. Then either insert a new cartridge to continue treatment or sterilize the handle so it's ready to use for the next appropriate periodontal patient. Arestin minocycline HCl microspheres 1 milligram is indicated as an adjunct to scaling and root planing SRP procedures for reduction of pocket depth in patients with adult periodontitis. Arestin may be used as part of a periodontal maintenance program, which includes good oral hygiene and SRP. Important safety information. Arestin is contraindicated in any patient who has a known sensitivity to minocycline or tetracyclines. Hypersensitivity reactions have been reported with its use. Post-marketing cases of anaphylaxis and serious skin reactions, such as Stevens-Johnson syndrome and erythema multiforme, have been reported with oral minocycline, as well as acute photosensitivity reactions. The use of drugs of the tetracycline class during tooth development may cause permanent discoloration of the teeth and therefore should not be used in children or in pregnant or nursing women. Tetracyclines, including oral minocycline, have been associated with development of autoimmune syndromes. In symptomatic patients, diagnostic tests should be performed and Arestin treatment discontinued. The use of Arestin in an acutely abscessed periodontal pocket or for use in the regeneration of alveolar bone has not been studied. The safety and effectiveness of Arestin has not been established in immunocompromised patients or in those with coexistent oral candidiasis. Use with caution if there is a predisposition to oral candidiasis. In clinical trials, the most frequently reported non-dental treatment emergent adverse events were headache, infection, flu syndrome, and pain. Please see accompanying prescribing information.
That was a lot of information, right?
Yep.
It's a
As
great video.
Yeah. So, as seen in the video, let me just give you a small demo on how it is done. So basically, Arestin comes in pre-measured cartridges like this, pre-measured cartridges. So we basically insert it into syringe and we tighten it up until we hear a lock sound. Now, these are inserted. Imagine this is a tooth site which is periodontally affected. So we insert the Arestin into the base of the periodontal pocket. So while inserting, make sure that the tip of the cartridge is parallel to the long axis of the teeth and is inserted till the base of the pocket and slowly release the Arestin. Now, it by the Arestin, as you release Arestin, when you remove it off, the Arestin bioadheres and bioresorbs within that area. So we don't need to, after 5 days or 7 days or 2 weeks, we don't have to come back and check that site whether it's resorbed or not because it automatically resorbs on its own. Also,
Mm.
once a cartridge is used, you can take it off and discard it, and the handle, the remaining stainless steel handle, it can go into sterilization. Depending on the site of the disease and depending on how the disease progression is, number of cartridges varies. It can start from one cartridge to 2 to 3 cartridges depending on the site and the bone loss. Any doubts, guys?
No,
Oh,
it was
that's
a
a great
very interesting
information.
information. Yeah.
Mhm.
So, okay, what are the pros and cons?
So the advantages include it targets infection locally, it's easy to place after SRP, it reduces the need for systemic antibiotics, and it can also improve patient outcomes in moderate to severe periodontitis.
But I would like to tell that it's not perfect. Disadvantages are there. First of all, cost, it can be expensive and work best in combination with SRP, not as a standalone. Some patients may have allergies to tetracycline, and
Mm.
last but not the least, it needs good patient compliance with home care. And Olga, I would like to discuss a fun fact with you. Did you know that Arestin isn't a cure? It's an adjunctive therapy. The real foundation is still SRP and oral hygiene.
Yes.
Wow, that's nice.
Yes, and Arestin is used in patients with deep pockets, like greater than 5 millimeter, after the scaling and root planning, especially when there is lots of inflammation.
We often use it in refractory cases when a patient's periodontal condition isn't improving despite treatment.
Mhm.
And now I would like to discuss some future outlook. The future outlook looks like it's exciting. Researchers are exploring next generation microspheres with longer release time, combining antimicrobials with host modulation agents, personalized therapies using microbiome testing to decide if Arestin or other local antimicrobials are best.
Okay, so it's part of precision periodontal therapy. tailoring care to the client.
Yes.
Good.
So we come back to Maria's question. Does Arestin make a difference? Is SR scaling and route planning enough?
The evidence shows that SRP is the gold standard. But in certain cases like deep pockets or resistant infection, Arestin enhances the outcome. Think of it as a boost, not a replacement.
Mm.
2021 review can even noted that patients receiving Arestin plus SRP had significantly better reductions in the pocket depth than SRP alone in many clinical. It has been proved in many clinical trials.
I got it. So Arestin isn't for everyone, but for the right client, it can make a real difference, right?
You got it.
Yes, Olga. So to conclude, Arestin is a powerful adjuvant in periodontal therapy, offering site-specific antibiotic delivery. It has its own limitations, but it's a valuable option in dentistry. And the future may have more exciting innovations.
And remember, periodontal health always starts with patient education and excellent oral hygiene.
Oh, thank you all. I feel much more confident about how and when Arestin is used.
Yeah. Thank you for joining, everyone. Thank you so much for this discussion. Until next time, let's keep smiling. Let's keep learning.
Thank you, guys.
Thank you.
Great discussion today. Thank you all.